Hi, Eugenia. How are you?
I am doing well. How are you today?
I'm great. Thank you for joining New Beauty and sharing your experience with us. And I know I'm going to say the name of the condition that you've been dealing with wrong, but I'm going to try it. Can you share your experience with Prurigo Nodularis and how it first started and what it is?
Absolutely. And thank you for allowing me to be here today to share my story. Any opportunity I get, I love it. And I thank you all and the Galderma research team for setting this up. Thank you so much.
Wonderful.
Well, I'll be glad to share. First of all, my journey began with me trying to lose weight. And I had started walking to exercise. And that was in February 17th, 2017.
Okay.
And 2 months into me walking, now I need to add that I am a pastor, and that's very critical for what I'm about to say. As I'm walking, being a prayerful lady, I hear the voice of God say, "Do you trust me?" And I thought, oh my goodness, what am I going to have to go through now? And
Right.
I said, of course, I trust you. So that started February 17th because I wanted to lose weight. 2 months into me walking, I started itching. And I thought, well, maybe this is just maybe an insect bit me or something, or I'm developing some type of seasonal allergy. I wasn't sure what was wrong, but that was in April
Right.
2017. Now, mind you, I had been itching for a while, but I didn't seek medical treatment because I just thought it would go away. Oh, the itching would go away. But then when it persisted into May of 2017, I said, this is not normal. I need to
Mm.
go and find a dermatologist. I went to local dermatologists and no one could tell me what this was. And so I finally called my sister and asked her who her dermatologist was because she suffers with eczema. And
Uh-huh.
she gave me the name of the director of dermatology in at a local university. And I went to see her. And by this time, because I'm scratching, nodules, black, hard nodules started appearing all over my body except my face.
Wow.
And that's how it started. And when I went to the dermatologist, the blessing out of all of that, believe it or not, I found out that I was type 2 diabetic. I
Wow.
didn't know. And so the doctors said at that time, they said, that's one of the symptoms of diabetes. And I was dropping weight really quickly. And I was thinking, well, yay.
Right.
And they said that those were some of the symptoms. So I ignored it even further based off of what they said.
So it causes itching all over your body, and from
Yes,
scratching and not being able to alleviate the itching, nodules can also form.
absolutely. It's a type of itch that's within the body
Got it.
that you can't quench it. You can't,
You can't put a cream
can't,
over it. You
no,
can't get a steroid shot and it goes away.
no.
It's coming from inside out.
Yes. And what I later found out in September of 24, um, uh, that is something that affects the spinal cord. It
Mm.
deals with the nerves in your spine that sends these messages that you're itching and you can't stop itching.
Wow. So it's not a skin condition that you're trying to alleviate. It's coming from that had to have been so frustrating.
Yes,
And then it's a night and day, all day type of sensation.
absolutely. It basically it's just unrelentless. It's that itch that you cannot fix. You can't get relief. And being the fact that it's within and no dermatologist could tell me what was wrong, I became more frustrated
Yeah,
and angry and all of that about it.
right. And you can't get away from it because it's happening from inside of your body.
Yes.
You must have so much relief right now.
Oh my goodness. Yes, yes, absolutely. I was itching like that from 2017 up until March of 2022.
So what came into your life that made a huge impact? It's a treatment, right?
Yes, a treatment that I went to as a result of meeting the director of dermatology. She saw my skin and it was just, I was covered with these black spots and everything. And she said, I have never seen a case like yours. And we have a research coming up and I would love to enroll you in this research for Prurigo Nodularis. That was the first time in 5 years that I even had a name to it.
Wow.
And she said, you are a great candidate. I said, well, is it life-threatening? She said, no, I think this is something that's going to help you. I said, sign me up, because to itch 365 days a year for 5 years.
That's a quality of life issue. So, I can't imagine what that's like. I mean, just thinking about having an itch for an hour, 2 hours, half a day, it is unbearable, always on your mind. And
Absolutely. It was all day, all night.
Yeah.
And sometimes scratching throughout the night if I could sleep, because I didn't get a full 8 hours of sleep for 5 years.
Yeah.
Because
And not knowing what it is.
Yes.
Yeah.
And seeing that the results of the nodules only came because I kept scratching. Had I known not to scratch and just try to bear with the itching, that wouldn't have happened to me.
Well, I got to say, that's hard for so many years to hold back. So I don't blame you at all. So the nodules, you had to treat that as a separate sort of skin condition. And then how did the treatment that you received, how did it help? Is it a topical? Is it a pill? Is it an injection?
Actually, it's an injection that I get once monthly at this stage, because I went through different stages of the research. So in the beginning, they were giving me a placebo injection, just, and I didn't know if I was getting the real medicine or not during that time. And so this is an extension of the first research. During the first research, they would just bring me in almost every week to ask me questions about how I was doing mentally, emotionally, how it was affecting me going out, and all of that. So I'm moving through different stages of it right now, and I'm still in the research.
And how long have you been on the actual drug, and how long have you been successful with this treatment?
March 16, 2022 is a day I will never forget. It was the first time that the real medicine now is being injected.
Right.
And I got immediate relief. The itching just literally stopped. As soon as that medicine started going in my body, I could feel the itching subsiding. And I thought, what in the world? And I'm still covered in all of these nodules, head to toe, except my face. And I was like, oh my God, I could sleep for the first time in 5 years.
Wow.
Immediate.
So it was an immediate improvement. And then I would assume over time your nodules healed, and that's no longer. How long did it take for you to sort of fully heal to a point where the nodules weren't a concern? And I know that itching goes away right away, but when do you feel like it made the biggest improvement?
I think within a year.
Okay.
Because when the itching stops, I don't scratch and the nodules disappear. Now, I still have scarring in certain, areas, but if you had seen my pictures, and I do have pictures of this, but if you don't scratch, the nodules won't appear.
Wow. But what a period of time in your life. I mean, you even remember the exact dates of these things happening, and you got that message on your walk. So how do you feel being on the other side of this journey?
If you're asking me, how do I feel now that the healing is taking place? Is that what you mean?
Yeah.
I am so much more happier. And I want to add something in here. I'm the eldest of 4 girls. And I was the one in our family, that was loved to laugh, loved to have a good time, very outgoing. But when this happened to me, I became reclusive. I isolated myself because of the embarrassment of it, the emotional toll it had on me mentally. I just isolated. I didn't want people seeing me like this. And if I had to go out, and I live in Alabama, so summers here are horrific, but I was always covered, even in the summer. But that was terrible for me because I could not get hot. I could not sweat without it irritating and causing me to itch more.
Uh-huh.
So after I went out one day and I had a little bit of my arm revealed and all of these nodules were on me and people were looking at me as though I was an alien, and it
Uh-huh.
just embarrassed me. But when I got that medication and the itching stopped and now I'm pretty clear, I'm happy again,
Yeah.
outgoing again. I am a singer and now I accept engagements now to go out publicly to sing. I'm good. I wear sleeveless outfits a lot. So
Yeah.
I'm happier and my self-esteem is back where it is.
That's wonderful to hear. And what a great outcome for you.
Thank you.
What do you want people to know who are suffering with this? It's rare, right?
It
It's a
is
rare,
rare.
yeah. Who are suffering with this ailment. What should they know? I mean, this sounds like such a great treatment. You don't have to think about it every day. It's a once a month injection, right?
It is. I would want them to first seek medical attention. As soon as they experience abnormality, it's like you can itch for a few minutes. That's normal.
Yeah.
But when it's ongoing for weeks and months, go find a dermatologist, someone to take a look at you.
Mm-hmm.
I would also gotta say prayer because it can really do something to your psyche with this. Because I was somewhat suicidal, but I didn't want to necessarily go through with it, but I was ready to go. I
Yeah.
didn't want to live like this.
But you couldn't
And
see
make
a
sure
way out.
I know, but and make
Yeah.
sure you have the support of your family. I think that's
Yeah.
very important. And I even suggested maybe with doctors who were just trying to slap a cream on it, please continue research,
Uh-huh.
not only to calm it down, but to cure it. That's what
Yeah.
I'm praying for. But I'm thankful for the calm. I am.
Yes.
I'm thankful for it. But I would tell people to seek medical attention. And once you find that, do what they tell you to do. I had to come off of certain medications that I was taking in order to participate with this research. Follow instructions and don't give up because now we have Nemluvio,
Yeah.
and I'm so excited. I'm so excited
And
about
you
this
can sing it.
medication.
You're singing again, Eugenia. And
Yes, I
that's
am. I
such a
am.
blessing, right?
It is. It really
Yeah.
is. And now that we have this, and I found that out. I found out in September of 2024 that Nemluvio is now FDA approved.
It is. It
It
was
is.
recently FDA approved. And I think this is so wonderful that you are coming out and sharing your story so people can sort of, relate and understand that there is a treatment option and you can get your quality of life back.
Absolutely. And talk to your doctor about Nemluvio because I can't say that it will help everyone. I don't know that. I just know it helped me. And what's the worst thing that can happen? That you have a conversation with your doctor.
Yeah. Wonderful.
And
Well,
I'm
thank you.
sorry. And I also heard recently that in December, Nemluvio is also FDA approved for those with eczema.
Yes.
Yeah.
And we're heading into that time of year too, where it's, people have a lot more flare-ups.
hmm
And I think it's great to have more treatment options, especially one you don't have to think about all the time and you can take just once a month.
Absolutely. Yes.
Yeah.
And so my study will be over in October of this year. I will be released from this 5 year, but I will be able now to go into a drugstore and have it prescribed to me that I can administer the injection myself.
That's so awesome. And you also were a part of making sure that it got approved too. So
Thank God.
we're helping other people at the same time.
What a blessing. I'm
Yeah,
very humbled by that because, maybe that's what God meant when he said, do you trust me? Maybe
absolutely.
he was positioning me and others that we can help with this research. Yes, ma'am.
Amazing. Well, thank you so much for sharing your story, Eugenia. And I know it's going to help a lot of people and help people find relief.
Thank you so much for having me, and I'm praying too. Thank you so much.
Thank you. Have a
You're
great
welcome.
day. Hi, Dr. Leo. Thank you for joining us today.
It's my pleasure. Thank you for having me.
When I was speaking with Eugenia earlier about her PN or the condition that was causing her to itch and have so many issues. She spoke about a new drug called Nemluvio for PN. So I'd love for you to explain what Nemluvio is and what is the mechanism of action, how it works, and how often patients need to take it, that sort of thing.
For sure. So we are very lucky because just as recently as just a few years ago, we had no approved treatments for PN, Prurigo Nodularis. And back only in 2017 did we even get our first systemic treatment for atopic dermatitis, and that was dupilumab back then. So before that, we literally had nothing that was approved. And now we have some really great options, including one of the newest, which is Nemluvio. That's the trade name. The drug name is nemolizumab. And this is a really exciting medication. It's an injectable medicine. So you do the shots. It's injected once every month, which is really neat. And then for patients with atopic dermatitis, if they're doing well after a number of months, they can even switch to once every other month. So every 8-week shot, which is pretty awesome. And it works in a very unique way. There's really nothing else out there like it in the space. Although interestingly, I have to say that that's for the human space. For dogs, canine atopic dermatitis, they actually have kind of a similar mechanism. And I think it's kind of fascinating. Dogs get really bad atopic dermatitis as well. So I think we've learned from the animal models that this is also something that works in humans. And the way it works is it's an antibody that binds to the IL-31 receptor. So this is the IL-31, interleukin 31 is one of the chemical messengers that sends the signal for itch and inflammation. And what it does is it kind of blocks that signal. It just gets in the way and says, no, quit telling this to feel itchy and uncomfortable. Quit telling this inflammation that's abnormal, right? By definition, abnormal inflammation blocks it just enough so that patients say, wow, I don't feel as itchy. My skin is not as inflamed and it's healing. And as you might imagine, that helps both for Prurigo Nodularis, PN, which is super itchy bumps that people get. It's so uncomfortable, but also for atopic dermatitis, which has a huge component of itch. And it's been really transformative for a lot of my patients. Even though it's only been out for a few months, I've already seen some really nice responses.
I can imagine that it really improves quality of life. And the fact that it's once a month makes it probably a lot easier to be compliant as well. And how soon does how soon does it work?
That's one of the craziest things about this. Even though it's a shot and you might think, well, it has to absorb and it has to kind of get everywhere, it might take a long time. There is evidence that within 48 hours, you can see a statistically significant difference from people in the placebo group. So for some patients, we're talking just a day or two, they're already noticing something. And I even had some of my patients call me and say, is it weird? I already feel better. Could it be? I'm like, it really could be. It works super fast because we think the nerve endings themselves actually have the receptor for IL-31. So by blocking it, you kind of almost instantly get that blockade of the itch, which is just for the patients who are like, I've been itching for so long. Suddenly I feel so much better.
Sweet relief, right?
Yes.
Wonderful. So who is a good candidate? Who should be looking into this drug a little more?
So for Prurigo Nodularis, PN, you have to be 18 years of age and older to qualify for it. So that's really for adults. But for atopic dermatitis, down to age 12, anybody with atopic dermatitis, so long as it's moderate or severe and 12 years of age and older, they're going to qualify. And that's pretty exciting. The dosing is the same. There's not a weight-based dosing. And same with the frequency. All that is pretty straightforward. And it's really anybody that is struggling. So obviously, if somebody has more mild atopic derm and they're doing fine with their creams, great. We're not going to push this on anybody. But I get all the patients who say, Doc, I've been using all these topical medicines. I've been putting on maybe too many topical cortisones and I'm worried that my skin is getting damaged. Or patients who've been on other systemic treatments. In the old days, we used to use immunosuppressants pretty regularly. And some patients still need them for varying reasons. And they're saying, but I'm still not where I need to be. Or now I've had a problem with one of these other things. My kidneys are unhappy or my liver is unhappy. So we're saying, oh my goodness. Right. And that's where this comes in, because what's nice about this nemolizumab, it doesn't require any blood monitoring because it doesn't go through the kidneys or the liver. It doesn't have any interactions with other medicines. So sometimes older patients are on a whole bunch of medicines. Maybe they're on heart medicines, blood pressure medicine, cholesterol medicine. They say, well, I can't take a lot of things because we can get into trouble, but this doesn't interact, which is really nice. And because, as you said, it's monthly, it's really easy for them to do. It's almost a painless injection. It's quite well. I couldn't believe it. The first time I administered to a patient, he looked at me and he said, did you do it? I'm like, yes. I'm like, you didn't feel it? He didn't feel it. It's very, very subtle. So all of those things mean that it can be a really nice tool in our toolbox. Obviously, it's not going to work for everybody. It's not going to be 100% for necessarily everybody, but for a number of my patients already, they said, boy, this has been really, really life-changing. And I'm just glad to have more tools in my toolbox to help people.
Wonderful. And it's available now, right?
It is. It is widely available throughout the United States, and it's actually launching in different parts of the world as we speak.
Wonderful. Well, thank you for coming on and sharing this information with NewBeauty, and we hope that this helps someone get relief sooner than later.
Thank you so much again for having me.
Thank you.